Have you ever wondered what it's like to be a trauma nursing sister? Let me show you.
Virgil Fredericks. I'm a trauma nurse, and my day consists of waiting for the unexpected to come into the emergency department. This is what I love about my job, the unexpected, and you are the first line of somebody's emergency. Our emergency equipment is our is on top of the priority for us. So defibrillators needs to be checked twice a day, so that is the first thing you do in the morning, so that you can know that you're ready for any emergency that you are waiting for the day, and also your ventilator as well. They are flown in either by fixed wing or heli. The helicopters comes on a daily basis. We see about 2-3 helis per day. I will show you through the unit of a journey from the patient from the helipad and to the ICU. Where patients comes in with their triage, and then they are triaged according to the South African triage score and treated appropriately. So this is the loadout machine. This is the first, if the patient comes in, this is a low dose X-ray machine. So the patient will go onto the loadout, you do a quick scan within 13 seconds of the patient entering here, then you have an idea of what is wrong with the patient. So in the area where we treat the patients, if there's anyone that needs to be upgraded to another, maybe to a priority one, we upgrade them and take them to the resuscitation area. Okay, so my nursing started in the Western Cape. I've done my training in the Western Cape in a private facility, and then I went to a trauma center in the Western Cape as well, feeling that I need to grow and move to Johannesburg, come to Milpark, and I've done the trauma course. I've just newly qualified my trauma speciality, and from here it can only go bigger, like become a teacher, become a manager, because this is where I want to stay in the emergency department.
Hi, I'm Tapelo. I am a trauma nurse. I studied at the University of Pretoria. I love my job because I work with the most sickest people and we manage to save their life. We've got a nice facility of level 1 with sophisticated equipment that enable us to do our jobs.
My name is Jordan Beskaghni. I'm an advanced life support paramedic for Netcare 911. I work from the Milpark base. So obviously Milpark being the flagship of all hospitals, grouped with their priority 1 patients, we often go to traumatic scenes and assess the patients, and when we do come across a patient that's priority 1 critical injured, traumatic, we obviously do the treatment, initiate treatment on scene, but obviously inform them at hospital, and then we're on our way to hospital, we bring them to Milpark Hospital.
So in this emergency unit, we have all sorts of people here, and even volunteers. So you're a volunteer coming just to help out in casualty, to shadow. Where are you from?
I'm from Fortress in Mpumalanga.
From Mpumalanga. And how long are you here to shadow?
For the whole week until Saturday.
And is this getting you prepared to see whether or not you'd like to go into nursing? Or medicine, or what?
Medicine. I would like to study trauma surgery.
Hi, I'm Marissa Chibert. I'm a trauma surgeon working here at Milpark Hospital, and we see P1 resusces very often and work very closely with an excellent team of nurses who are really very supportive, and without them we can't function.
The trauma surgeons is notified with the paging system that we have, and as soon as possible we want to get the patient out of the unit within an hour. Our recess time, we have the golden hour that we are working with. Okay, as soon as the call is activated by the emergency department, services, they will let us know what is the expected time of arrival, and we work according to that expected time of arrival to get everything ready and be ready, nurses, doctors, for the patient to begin treatment. I love my job is the unpredictability of the day, and people will come in. We are the first line of treatment, and that is why I love my job so much.